Omeprazole is used to treat certain stomach and esophagus problems, such as acid reflux, ulcers. It works by decreasing the amount of acid your stomach makes. It relieves symptoms such as heartburn, difficulty swallowing, and cough. This medication helps heal acid damage to the stomach and esophagus, helps prevent ulcers, and may help prevent cancer of the esophagus. Omeprazole belongs to a class of drugs known as proton pump inhibitors. How to use omeprazole? You'll usually take omeprazole once a day, first thing in the morning. It will not affect your stomach, so you can take it with or without food. If you take omeprazole twice a day, take one dose in the morning and one dose in the evening. Swallow tablets and capsules whole with a drink of water. If you have problems swallowing capsules, most brands of omeprazole capsules are easy to open. This means you can empty the granules inside and mix them into a small amount of water. You could also sprinkle them on soft food, such as yogurt or apple puree. Talk to a pharmacist if you are not sure whether you can open your capsules. Omeprazole also comes as a tablet that melts in your mouth. Dosage. Each tablet or capsule contains 10 mg, 20 mg, or 40 mg of omeprazole. Liquid omeprazole comes labeled as either 2 mg per 1 ml or 4 mg per 1 ml. The usual dose to treat indigestion is 10 mg to 20 mg a day. Heartburn and acid reflux is 20 mg to 40 mg a day. Stomach ulcers is 20 mg to 40 mg a day. Zanga-Ellison syndrome is 20 mg to 120 mg a day. Doses are usually lower for children and people with liver problems. How long to take it for? If you buy the medicine yourself from a pharmacy or supermarket, you can take it for up to 14 days. If you feel no better after taking omeprazole for 14 days, tell your doctor. They may want to do tests to find out what's causing your symptoms or change you to a different medicine. Depending on your condition or the reason you are taking omeprazole, you may only need it for a few weeks or months. Sometimes you might need to take it for longer, even for many years. Some people do not need to take omeprazole every day and take it only when they have symptoms. Once you feel better, often after a few days or weeks, you can stop taking it. But taking omeprazole for a short time to treat symptoms is not suitable for everyone. Talk to a doctor about what's best for you. If you forget to take it. If you usually take it once a day, take the missed dose as soon as you remember. If it's 12 hours or less to your next dose, do not take it. If you usually take it twice a day, take the missed dose as soon as you remember. If it's 4 hours or less to your next dose, do not take it. Do not take 2 doses to make up for a forgotten one. If you forget doses often, it may help to set an alarm to remind you. You could also ask your pharmacist for advice on other ways to help you remember to take your medicine. Contraindications: hypersensitivity to the drug, childhood, pregnancy, lactation. Precautions: before taking omeprazole, tell a doctor or pharmacist if you are allergic to it or to similar drugs, such as esomeprazole, lansoprazole, pantoprazole, or if you have any other allergies. This product may contain inactive ingredients which can cause allergic reactions or other problems. Talk to a pharmacist for more details. Before using this medication, tell a doctor or pharmacist your medical history, especially of liver disease, lupus. Side effects. Common side effects. These common side effects of omeprazole happen in more than 1 in 100 people. There are things you can do to help cope with them. Headaches, feeling sick, nausea, being sick, vomiting or diarrhea, stomach pain, constipation, farting, flatulence. If this advice does not help and any of these side effects continue to bother you, tell a doctor or pharmacist.